Hello everybody and welcome to this course. My name is Marcel and it is a great pleasure to introduce you to the world of medical imaging. During the next lectures, you will learn what medical imaging actually stands for and why it matters. Let us start with a simple emergency case. It is about a young patient who comes to the hospital with severe pain in the right chest region and difficulty of breathing. He also mentions that he had a cold for the past week. In order to approach the right diagnosis, a chest X-ray examination was performed. You can find the resulting image here. What can be seen is that the right lung collapsed, a so-called pneumothorax. This is a life-threatening condition that can be diagnosed using medical imaging techniques, as you can see here. So, what is medical imaging? Generally speaking, medical imaging provides spatially resolved information from within the human body. As you will see, this can be done using different imaging techniques or modalities in a wide range of applications. The most common medical imaging modalities are shown here. Probably the most prominent one is radiography, also known as X-ray imaging. This can be either performed in a two-dimensional space called projection radiography or in the three-dimensional one called computed tomography or CT. When diagnosing the pneumothorax a little bit earlier, we looked at an example of projection radiography. Then there is magnetic resonance imaging or MRI, which is also a three-dimensional imaging modality based on magnetic fields. Another common modality is ultrasound, which uses sound waves to produce images from within the body. Finally, a less frequently used method is the positron emission tomography, or in short PET, which is often used for tumor staging. As already mentioned, medical imaging is used for a variety of situations. To diagnose diseases, to plan therapies, and also for image-guided interventions, as an example, for surgical procedures. Thus, we can summarize that medical imaging is important for almost all fields of medicine. Before continuing, we should absolutely have a few words on how to navigate through medical images. First of all, we usually name left and right according to the patient's perspective. This means that most of the time the left side of an image is the right anatomical side and vice versa. When recapping our initial case example of the pneumothorax, this also explains why we diagnosed that the right lung collapsed. Second to that, we usually look at three-dimensional images or volumes using two-dimensional cross-sections. The orientations of these planes have specific names, making it easier to talk about medical images. We have the axial or transversal plane moving from the top to the bottom or vice versa, the coronal or frontal plane, which moves from front to back or from back to front, and last but not least the sagittal plane, which moves from left to right or from right to left. Alright, let us now conclude this lecture by talking about the anatomical orientations. In this figure, you can find a summary of the three different orientations, but this time with a description of some anatomical planes. During this course, we will only use the following 6 directions. Regarding the coronal orientation or plane, posterior means further back and anterior means further in the front. Regarding the axial plane, inferior means further down and superior means further up. And last but not least, left and right along the sagittal plane, which we already discussed. It is extremely important to note that again these directions are described from the patient's perspective. Alright, in the next lecture we will talk about projection radiography in more detail. Thanks and see you soon.